Defining dementia and its denial. Dementia is a disease that affects the brain. It is important in acknowledging Alzheimer's disease and other forms of cognitive impairment. People living with dementia and their loved ones are often in denial about their changing abilities, blaming their forgetfulness on simply just getting older. They will deny needing any help, asking for help, or anything like that. It is normal to have difficulty accepting this. No one likes to admit weakness, the inability to do something. Dementia is something that can be tested for and diagnosed. During early stages of dementia, they may prescribe a medication to hopefully slow the process. Unfortunately, this does not work for everyone, and there is no cure. You may notice things like your loved one repeating stories, relying on cues to get them through their days, such as notes and reminders they or you may have left them. They may be forgetting to take medications or changing into clean clothes, taking care of the animals. We like to think this is what happens when we grow older. However, this is much more than simple senior moments. This disease is something extremely hard to accept when someone you love is involved. When something happens, we tend to want to avoid what is happening and we make excuses for them. Recognizing dementia, Alzheimer's, is only the first step. There are 6 dangers of denial for dementia caregivers. 1. Avoidance. There are many emotions that we feel when watching a loved one struggle with Alzheimer's disease. We sometimes feel uncomfortable because it is not like how it used to be, and can sometimes feel like we're talking to a stranger. You may start slowing down how often you visit. It changes the way you connected, but it doesn't mean you can't spend quality time with them. Something I think of is we mourn the person who they once were and who we remember they used to be. And it's hard, and it's okay. 2. Family conflict. Being in denial can prevent you and your family members to understand what is going on and the needs their loved one has. It can lead into tense conversations with siblings or adult children, and sometimes lead to being detrimental to their loved one's health. It is important to create a successful care plan for your loved one. 3. Legal complications. Your loved one is no longer able to execute legal documents or make decisions in regarding to their health and well-being. Without proper legal documentation, it could lead into complications to the care they need in the future. It is necessary to have those difficult conversations and to appoint the person who will be aiding in this. 4. Financial. During these times, we are all getting targeted for scams and financial frauds. Memory loss can lead to believing in these frauds, writing duplicate checks, or making poor financial decisions. They may also fall behind on their bills, and family members don't realize until it's too late that payments were missed. 5. Caregivers put their health at risk when they're in denial about the help they need caring for a loved one. They often burn themselves out, or they obtain an injury when trying to care for the person. Caring for a loved one at home can be draining physically, mentally, and emotionally. It is important to know the resources you have to provide the best quality of care to them and making sure you're okay as well. I have 5 tips to help you accept an Alzheimer's diagnosis. 1. Understanding the signs and symptoms. It is especially important to remember that not everyone is affected the same. There are many different types of Alzheimer's disease and dementia and cognitive impairments. 2. Keep a record. Document the signs and symptoms and what triggers those. Write down your thoughts and fears to help you process what is going on. 3. Learn about dementia. There are many resources out there to help you, your loved ones, get through this. 4. Support groups. Talk with someone. There are trusted sites I've attached where you can connect with others who've gone through similar situations. It might just provide a little peace of mind or just someone to talk to. 5. Ask for help, please. It is okay to ask for help. It is okay to not be okay. And we would never want you to put you or your loved one in harm's way. There are many different resources that are available to you. There are adult day programs, part-time home care, and respite options to provide you with a break from caregiving. There's also memory care communities and programs that are designed to enrich their life and to cater to their individualized needs with trained professionals who understand what they're going through. As a family member or caregiver, it can be very conflicting with how you feel. We all want what is best for our family and friends and to make sure they're taken care of. When there is a cognitive decline, your loved one will need physical care, comforting, keeping their dignity, making sure they are safe, and secure accommodations for them. They have companionship and respect.